Why do we start CPR on pediatric patients whose heart rates have dropped below 60? Continuing the conversation on pediatric bradycardia, pediatric advanced life support, or PALS, calls on you to ventilate and oxygenate pediatric patients in a state of poor perfusion whose heart rates have dropped below 60. And if they don't respond to that, then you're supposed to start CPR. That's because pediatrics in a state of poor perfusion are a one-trick pony. They have one tool at their disposal to compensate for this, and that is increased heart rate. And if they can't maintain that increased heart rate, we have to generate that heart rate for them. Data also demonstrates that when we start CPR in these patients and they eventually become pulseless, that they are more likely to survive than patients who don't have CPR performed on them before they become pulseless. If bradycardia persists, you're supposed to move on to administering epinephrine. And we've already talked about how the administration of epinephrine will probably trend away from giving a code dose of epinephrine in these patients and giving a push dose of epinephrine in these patients. The algorithm also indicates atropine, and this has confused some people. You don't administer atropine as a matter of routine here. You administer it for increased vagal tone or primary AV block. These kids are almost always bradycardic because of hypoxia. They are rarely bradycardic because of increased vagal tone, and almost never bradycardic because of primary AV block. And on this subject, administering atropine for increased vagal tone is something we do to make the patient feel better. Administering atropine for primary AV block is something we do to make ourselves feel better. I'll also mention that transcutaneous pacing is in this algorithm. Follow your local protocols, but electrical solutions in pediatrics are generally for electrical problems. Sinus node dysfunction, second-degree type 2 heart blocks, complete heart blocks, not as a solution to hypoxia-induced bradycardia from non-electrical causes. Again, follow your local protocols.